Ladies and gentlemen, good evening once again. And now we have arrived at a moment that truly celebrates the spirit of everything we have discussed today. Because this is not just an award ceremony where dedication finds spotlight, where those shaping the future of stroke care in India are celebrated the way they truly deserve. Tonight is about the individuals who didn't stop at challenges, the institutions that pushed beyond limitations, and the leaders who chose to build stronger, faster, and more effective stroke care systems across prevention, treatment, and rehabilitation. Welcome to the Stroke Excellence Awards 2026, an initiative that honors real, measurable contribution and sets benchmark for excellence in stroke care across the country. And I must say this, the kind of nomination we received this year were truly outstanding, which also made one thing clear, that incredible work is happening across India, often quietly, but with powerful impact. And of course, that also meant one very tough job for our jury members. So I would also like to take a moment and appreciate their efforts for this. And to everyone who has nominated, you are already creating a change. Tonight is simply about celebrating that journey. So ladies and gentlemen, let's begin this evening of recognition, inspiration and excellence. To set the tone, I would like to invite Dr. Nishal Naveen, founder, Voice of Healthcare, for his opening address.
Thank you, Simran. Once again, very good evening and welcome to much awaited award ceremony. I think with one stroke patient, there are a lot of missed opportunities to prevent that one stroke. Right from treatment of hypertension, reaching on time to hospital, even after stroke, proper rehabilitation. So there are a lot of missed opportunities. And during this year, while going through nomination process, when I was reviewing all nominees, it was very heartwarming to see real change maker in stroke care in our country who are making real difference for this particular problem. And we have people across care continuum working in this particular area in our country. And today we are going to celebrate their victory. Today we are going to recognize their real hard work, real effort. With that, without taking much time, we announce beginning of our much awaited award ceremony. Thank you. Thank you for being a patient audience. Thanks a lot. Thank you.
Thank you, sir. May I now also take a privilege to invite a distinguished neurologist and the head of the Department of Neurosciences with an illustrious career dedicated to advancing stroke care and neurological sciences, Dr. P. Vijaya, to kindly join us on stage as a special guest. She has served as the immediate past president of the Indian Stroke Association and past president of the Andhra Pradesh Neuroscientist Association, and a respected member of the Asian Stroke Advisory Panel. Ma'am, I would like to have your special address, please.
Thank you, VOH, for this excellent initiative. Stroke is a huge burden and a big job. It's not by one person or one organization. Ideally, the academicians, the clinicians, the researchers, the NGOs, public, and of course the government should all work together in this huge task of decreasing the burden of stroke in India. In this endeavor, today we have seen so many good discussions, initiatives, and also resolutions, which is easy to go into the public. Prevention with simple measures, awareness about the time-sensitive treatments, and of course the policies to bring every best evidence-based treatment to all the needy patients free of cost. That should be the ideal situation. And I congratulate all of you for being the soldiers are in this a big war against stroke, warriors of against stroke. I congratulate and encourage you to do more, because nothing is enough to bring down this stroke burden. Let us all work together with enthusiasm and continued efforts to handle this stroke burden in India. Jai Hind, and thank you very much for giving me this opportunity, VOH.
Ma'am, we request you to please stay back, and I would like to call Dr. Nishchal Naveen to please felicitate and honor our special guest, Dr. P. Vijaya. Thank you, sir. Thank you, sir. Thank you, ma'am. And I would request you to please stay back as we begin with the award ceremony. So just a small important note, the order in which the awards are presented this evening does not imply any ranking or hierarchy. Each winner has been recognized for their unique contribution, impact, and excellence in their respective field. Every story we celebrate tonight stands equally powerful, equally meaningful, and equally inspiring. And of course, to have this energy throughout, I would request my audience to keep on the applause going on and keep rolling your hands. And at the end, we will have a group picture with all our award winners, esteemed speakers, and panelists. Starting with our individual award, Advanced Stroke Intervention Center of Excellence South. And the award goes to KIMS Al Shifa Super Speciality Hospital for establishing one of the region's most advanced comprehensive stroke unit equipped with dedicated stroke, ICU and neurocath lab, enabling cutting-edge neurointerventions including mechanical thrombectomy. They have set a new benchmark in delivering high-quality, accessible stroke care while also contributing to the training of future stroke specialists. So, can we have few words from you? So one more important note, that come prepared with your winning speech, as we would like to hear your moment. Our next category is Young Changemaker in Stroke Care Under 40 North. And the award goes to Dr. Abhishek Bhargava for pioneering stroke care delivery in rural setting and driving awareness around the critical importance of timely intervention through dedicated efforts in community education and clinical practice. He has successfully established thrombolysis services enabling early stroke treatment and laying the foundation for advanced stroke care in underserved regions.
Good evening to one and all, respected my seniors. And I would like to tell that I am from Jaipur. I practice in the periphery of Jaipur in a town called Chomu. Over there, the rural population is coming, and we have started thrombolysis since last 1 year. I passed out last year from SMS, and now we are going to start thrombectomy also in the upcoming months. So one thing I would like to highlight, in Rajasthan, there is a town called Butati. You must have heard of it. So every patient who comes to us, they say, why are you going to treat us? What will you do? We will instead go to Butati Dam. So we tell them that for next 4 or 5 days you stay here. Butati Dam is not going anywhere. After taking treatment, you go there. So now what Butati is doing, that they say that if you take the treatment in initial 4 days, the Butati magic will not happen. So these are the challenges we are facing in the rural areas, and we have a long way to go. I hope in the next few years there is more awareness in patients. Thank you so much. And I would like to thank Voice of Healthcare for selecting me for this nomination. Thank you.
Thank you, sir. Our next category is Young Changemaker in Stroke Care under 40 East. And this award goes to Dr. Arpan Datta for emerging as a promising young leader in stroke care contribution to clinical excellence and advancing patient-centric stroke management practices, while also strengthening the delivery of timely and effective care within the leading healthcare institution.
So I am extremely honored to receive this prize, and I am very grateful to the organizers and Voice of Healthcare for allowing me to receive this present in this prestigious event. So I have been working actively in the telestroke project of West Bengal, which involves a network of 41 hospitals, and we have completed almost 1800 thrombolysis since 2022, and I am also actively involved in research and awareness strategies to reduce pre-hospital delay as well as in-hospital delay, and also I am involved in doing advanced researches involving VR therapies in rehabilitation and many more projects funded by ICMR and multiple international projects. So thank you. It will be an inspiration for me to keep going on and excel in my future life. Thank you. Thanks,
sir.
the organizer.
Thank you, sir. Our next category is Emerging Excellence in Speech and Swallowing Rehabilitation Stroke Care. And the award goes to Mr. Uzair Chilwan for advancing in the field of speech and swallowing rehabilitation through impactful research focused on stroke, particularly highlighting swallowing-related fatigue as a critical yet under-recognized dimension and contribution to more comprehensive patient-centered rehab approaches. Thank you, sir.
Good evening, all. So, just a brief introduction about me. I am a speech swallow therapist pursuing my PhD from Kasturba Medical College, Bangalore. So, I got my funding from ICMR. I am currently working as a research scientist. So, my topic was basically to assess what is the phenomenon of swallowing related fatigue. Like, is there a specific phenomenon and how does it affect eating and drinking behavior in post-stroke individuals? So that was a pretty challenging topic at first because this phenomenon had come after the post-COVID era, where we had patients who reported that they felt tiredness while swallowing. So to narrow it down, we wanted to explore in which muscle, is it masticating muscle, pharyngeal muscles. So keeping that in mind, we moved ahead and explored the prevalence rate across the different stages of stroke, phases of stroke, that is acute, subacute and chronic, and also we also saw that it affected the mealtime patterns. The swallowing fatigue affected the mealtime patterns in the post-stroke patients. So our current study was basically focusing on the assessment of swallowing fatigue. Future studies will be focusing on the treatment management, like what algorithm can be decided with the help of multidisciplinary team. And finally I also like to thank the Voice of Healthcare and my guide, my humble parents and my beautiful wife sitting out there for believing in me, and so thank you.
Thank you, sir. I would request our winners to please keep their winning speech short and sweet. Now, before we move ahead to our other categories, I would just like to take a moment to honor and felicitate our another special guest for his contribution in excellence in neurosciences leadership. And for this, I would like to call upon Dr. Professor Rajendra K. Dhamija. Sir, can we please have you on stage? Professor Rajendra K. Dhamija, Director of the Indian Institute of Human Behavior and Allied Sciences, New Delhi, is recognized for his distinguished contribution to neurology and public health. With over 3 decades of experience, his leadership in research, academic excellence with institution building has significantly advanced neurological science with a strong impact in stroke movement. So,
good evening, everyone. It's an honor and a privilege to be here and with this honor from Voice of Healthcare. My passion with neurology and stroke goes to 30 years, and I was in Australia for many years. I decided to come back to serve my own country, and here I am working for the poorest of the poor in this country and making them stroke care and neurological care accessible, available, affordable and adaptable to our own society. I'm grateful for my teachers, Professor B.C. Bansal, who just passed away a couple of months ago, and who took me to the neurology and then guided me and mentors me throughout my career, and the rest is the history. I also owe my success to my patients and my colleagues and my teachers, and in Lady Hardinge Medical College, where I started the Department of Neurology as a founder head of the department, and then moved on. With this acknowledgement and this honor, I dedicate this to my patients in Lady Hardinge Medical College. Thank you.
thank you, sir. And congratulations. So, we would request you to kindly stay back with us for the further award ceremony and join Dr. Nishchal and Dr. P. Vijaya. Moving ahead with the next category in excellence in stroke rehabilitation leadership, and the award goes to Dr. Shaheen K.E. for his visionary leadership in transforming stroke rehabilitation through the establishment of a comprehensive multidisciplinary care model, integrating medical rehab therapy services and long-term reintegration strategies. Our next category is Excellence in Speech and Swallowing Rehabilitation Stroke Care, and the award goes to Dr. Suparno Das for excellence in implementing evidence-based multidisciplinary protocol in speech and swallowing rehab, including early screening, advanced diagnostics, and high-intensity therapy models, leading to improved clinical outcomes and enhanced patient care. Congratulations, sir.
Many thanks, VOH, and especially CMRA Hospital and Dr. Deepdas sir for giving me opportunity and selecting me. When I have started my speech pathologist journey, at that time, most of my batchmates going to audiology practice. I am the only one started in Kolkata in 2008 as a speech pathologist, knocking all the hospitals. There was no job, so I started my career as a freelancer and started to speech and swallow in the acute care. Now in Kolkata, presently I am an entrepreneur. I built a Bengal Rehabilitation Group, a startup, presently which is Bengal's largest hospital-based hearing and speech care chain. I have tried till date and continuing my journey, and this award helped me a lot. Many thanks. Thanks to all.
Thank you so much, sir, and congratulations. Our next category is Excellence in Acute Stroke Intervention Neurologist East, and this award goes to Dr. Apratam Chatterjee. He is recognized for his leadership in advancing stroke intervention in Eastern India, delivering timely and high-quality care to a diverse patient population, while addressing the critical challenges of making advanced stroke treatment both accessible and affordable. Congratulations, sir.
Very good evening to all of you. First and foremost, thank you so much, VOH, for recognizing and motivating us. If I do not thank my family for the enormous amount of sacrifices for which I am here today and maybe in future. Because most often my day starts as an interventionist in the cath lab when my daughter is hardly awake. My family has to take care of the rest. And when I enter my home, my daughter is again asleep. So this is how the life of an interventionist is. And it will be incomplete if I do not thank all my mentors, my seniors, starting from the people who have taken the pain to train me hard during my 2 years of fellowship days, starting from Dr. Gaurav Goyal, Dr. Inshu, my seniors, Dr. Biplab Das, Dr. Vineet Banga is here. My wife and daughter have come here to greet me here, and my family back home. And most importantly, I thank my patients, more so those whom I could not salvage the brain, with intense effort from all of my team members and all my colleagues, without whose effort a stroke intervention is incomplete. Thank you so much again, VOH.
Thank you, sir.
ma'am. Thank you, sir.
Thank you, sir. Our next category is Excellence in Acute Stroke Intervention National. And this award goes to Dr. Sumit Goyal. For over 2 decades of excellence in neurosurgery and neurointervention, and for his leadership in advancing complex stroke and cerebrovascular care through cutting-edge techniques and clinical expertise. His contribution continues to elevate standard of care and expand access to advanced neurological treatment across the country. Thank you, sir, and congratulations.
Just like to thank everyone for this. I think stroke is a huge responsibility, and we all together are part of it. And this award doesn't belong to me alone, and I think it belongs to the whole team, from every individual who is putting their effort from ER to the last caregiver to stroke patient. Thank you. Thank you.
Thank you, sir. Moving on to our next category, Excellence in Acute Stroke Intervention North. And this award goes to Dr. Vineet Banga for his expertise in acute stroke intervention and delivering timely, high-quality neurological care, contributing to improved patient outcomes through precision-driven clinical practices and a strong commitment to advancing stroke treatment. Congratulations, sir. Thank you, sir.
Thank you, VOH. Thank you, everyone. It's a long Sunday for all of us, and I'm glad to serve any patient of stroke. I think stroke care is still far from where it should be. It is yet to be democratized, still available, but available to only few of those who actually require it, and still not available to anyone who actually requires it the most, and the most vulnerable, the most vulnerable of us all. So we need to democratize the stroke care, and I'll thank VOH in actually getting on this platform up and ready and making us talk about it at least, because it's the first step that matters in a long journey. Thank you very much.
Thank you, sir. Our next category is Excellence in Clinical Neurology Practice North, and this award goes to Dr. Bhupesh Kumar for integrating innovative AI-driven approaches into clinical neurology practice, enhancing diagnostic precision, decision-making and patient follow-ups, while delivering impactful stroke care through real-world clinical excellence and improved patient outcomes. Congratulations, sir.
Well, thank you, VOH and the jury, for selecting me and giving me this award. Never expected that. But I believe and I thank all my team, my patients, my family, everyone. And I believe that medicine is a responsibility that is entrusted to us and given to only a few by the Almighty. And I guess we are doing a pretty good job in there. So thank you for everyone. Thank you for that.
Thank you,
Thanks.
sir. Our next category is Stroke Care Leadership Award North. And this award goes to Dr. Biplab Das for outstanding leadership in advancing comprehensive stroke care and neurointervention, for his contribution to strengthening clinical system, expanding access to advanced stroke services, and mentoring the next generation of stroke specialists. Let's keep our hands rolling for all our winners today.
Well, good evening all. So, thank you for this wonderful recognitions. This award is not only for me, it's a whole entire team for comprehensive care. Let's keep up, and thank you VOH for taking this initiative. Thank you very much.
Thank you, sir. Our next category is Clinical Excellence in Acute Stroke Care North. And the award goes to Dr. Mohit Maan for strengthening acute stroke care delivery through its implementation of efficient stroke code, activation system, and coordinated multidisciplinary response, ensuring timely diagnosis, rapid intervention, and improved patient outcomes.
Good evening, everyone. First of all, I would like to thank VOH and everyone for providing me and recognizing me this honor. Dhamija sir has remained my examiner during my DM final year. So, what I'm able to provide acute stroke care is due to all my mentors, teachers, what I have learned during my DM tenure and from my parent institution. So, acute stroke care is not about individual doctor or individual neurologist. It's about a team response from emergency team, the whole emergency preparedness response. So I would like to thank all my team, my patients who trusted me.
Thank you, sir. Congratulations. Our next category is Community Champion in Stroke Awareness, and this award goes to Dr. Tafasana Vairokam for her remarkable commitment to advancing stroke awareness in her community, leveraging mass media and public engagement to educate populations on stroke prevention and care, while bridging the gap between global medical expertise and grassroots healthcare needs. Congratulations, ma'am.
Good evening, everyone. I'm beyond humble to receive this award. I'm from Manipur, where stroke care is still in its very nascent phase. And we understand that stroke prevention and awareness is as crucial in Manipur as acute and hyperacute treatment. I would like to say that it's a huge motivation. Thank you, Voice of Healthcare. Huge motivation to those who have the will to change the status quo. Thank you.
Thank you, ma'am. Thank you so much. Next category is Excellence in Stroke Education and Training. And this award goes to Dr. Gajanan Bhalerao. Dr. Gajanan Bhalerao is founder and director of GB School of Neuro Rehab and Aquatic Therapy, Pune, and professor and principal of TMV. He is recognized for his outstanding contribution to neuro rehabilitation, education, and training with extensive experience in neurophysiotherapy. He has played a pivotal role in advancing evidence-based stroke rehab. Thank you, sir.
Thank you, Voice of Health, and thank you all the jury for giving us this award. I am from physiotherapy faculty, and we run a admission-based rehab center in Pune. There are 3 centers. You guys are doing the acute care management, and we are the people who come in later half. And thanks, you guys are appreciating our work also. Thank you.
Thank you, sir. Congratulations. Our next category is Stroke Neurologist of the Year East. And the award goes to Dr. Deep Das He is the Director Neurology. He is recognized for his extensive clinical expertise in acute stroke management and neurointervention, with strong background in advanced procedures including thrombolysis, stenting and neurovascular intervention.
Dr. Deepdas couldn't be here today, but he sends his humble regards and thanks to VOH for this award. Thank you.
Thank you, ma'am. Our next category is Stroke Neurologist of the Year North. And this award goes to Dr. Vivek Kumar, Principal Director, Neurology at Max Super Speciality Hospital, Pratapganj, is recognized for his instrumental role in advancing stroke awareness and strengthening stroke care delivery at regional level. Through his leadership, he has actively promoted community engagement and initiated effective stroke treatment strategies. Congratulations, sir.
Good evening, everyone, and thank you, VOH. I have had a privilege to sit through throughout the conference, and it was a very useful discussion today. I've been associated with Max Healthcare for last 13 years. Max Pratapganj was first few centers in the private sector to get recognition of early stroke ready center. And in 2023, we were accredited as an advanced stroke center from QAI and ISA. So it's been a long journey and a lot to be done. Thank you.
Thank you, sir. Our next category is Excellence in Neurology, Education and Leadership. This award goes to Professor Dr. Vivek Lal. He is the Director of PGMI Chandigarh and a distinguished neurologist with decades of experience in clinical practice, teaching and research. He is recognized for his exceptional contribution to neurology, education and leadership. Our next category is Stroke Research Innovator of the Year. And this award goes to Dr. Shailesh B. Gaikwad. He's a professor and head of the Department Neuroimaging and Interventional Neuroradiology at AIIMS, New Delhi, and the Chief of Neurosciences Center. He's recognized for his outstanding contribution to stroke research and intervention, a leading expert in advanced neurovascular procedures.
Good evening, everyone. I am humbled and overwhelmed by the award which has been given to me by Voice of Healthcare. The award goes to my entire team who rushed in the middle of the night to assist his professor and head. At the challenging hours, my entire paramedic team, that includes the nursing staff, the technicians, the radiographers, and the ICU care team. And my journey in intervention began 35 years back when I joined this institute. Apart from playing my role in aneurysms, AVMs, I think stroke, I realized, was a major challenge. Just as an interesting thing, when I joined as a resident in radiology in 1988, you will be surprised to know that my first topic on seminar was carotid angioplasty and stenting. So what was the data then, and today look at it. And today, the CREST-2 trial has established that we have lowest incidence of complication if stenting is done by the expert. Intervention, my first case, almost 26 years back, when one of the health secretaries, sitting health secretary, had a dense hemiplegia while he was delivering a talk in his office. And my colleague just rushed into the angio lab. That was 4 p.m. and she said, Shailesh, one VIP is on the way, so better you wind up these things. And when I saw him have to intubate, and in those days, remember, there was no trial on mechanical thrombectomy, but we managed to open the entire large vessel, occluded. Next day morning, he woke up, he had a breakfast, and today he's settled in Australia. I don't want to name him, but we have seen a long journey. And this is all because of my teachers, my mentors. On his giant shoulders, we are standing basically. So the entire credit, I think, is a teamwork. And thank you for appreciating the work done by the workers, because that has to, basically they encourage them. So thank you. Keep this work going, I think. Thank you very much.
Thank you so much, sir. And congratulations. Our next category is Outstanding Contribution to Stroke System Leadership. And this award goes to Padma Shri Dr. M.V. Padma Srivastava. She is the chairperson neurology at Paras Health, Gurugram, recognized for her extraordinary contribution to advancing stroke care system in India. With a distinguished career spanning over 4 decades, she has been a pioneer in establishing hyperacute thrombolysis programs, shaping national stroke guidelines and developing stroke registries. We now move on to another category, Stroke Neurologist of the Year National. And this award goes to Dr. Methil Pradeep. He is recognized for his landmark contribution to stroke management in India, particularly as the principal investigator of Tenect Place stroke trial, which led to its approval in the country, making thrombolysis significantly more accessible and affordable for patients. Thank you, sir.
Good evening, everybody. So very nice to be here, and especially taking this my very close friend Vijaya and Nischal. Thank you, sir, for being here. See, a journey of a doctor and especially I would say neurologist never ends academically. I think cardiologists have all come to a saturation point in what they can do. We have still a long way to go. Very, very long way. We are only, I would say, not even halfway through. As far as intervention is concerned, for a kind information, I am an interventionist too. I did my neurovascular intervention from University Hospital Zurich long back, 2008, under Professor Valvanis. But my interest changed to neurozonology, transcranial Doppler. So I pioneered transcranial Doppler in our country. And we are doing extremely, I think a lot of students are coming from all across to learn transcranial Doppler. And I am so proud that I could contribute to the Indian stroke, not only the world stroke, by bringing in Tenect Place sanction by the DCGI in the country. So that it really transformed the way in which how many thrombolysis was happening in the country. From, as I told you before, approximately some 500 thrombolysis per year to almost now 40 to 45,000 thrombolysis. Still, that is not the end. Tenect Place is not the end of the game. It is better. We have proven that it is a equally efficacy and probably a better molecule. Very easy to give. Probably once we have better molecules other than that, probably with less hemorrhagic this thing, probably the thrombolysis may be the rule of the day. That is what we want, because even if it is long duration, why we are not giving after 6 hours, 7 hours? Because of the chance of hemorrhage. If something comes which is very highly clot specific, which does not affect any other part of the system, then that will be the drug. Hopefully we'll have such thing also. And you know, stroke has given India pride, because we are the people who brought in Tenect Place. All other countries followed only. Now this has come into all the guidelines across the globe, even the American Heart Association, American Stroke Association guideline. Tenect Place is there in this thing. So thanks Almighty, thanks all my friends, patients, family for making this journey meaningful. Thank you very much.
Thank you, sir. Our next category is Excellence in Neurosurgical Stroke Intervention. And this award goes to Dr. Ashish Gupta. He's the Principal Director at Max Super Speciality Hospital, IP Extension. He's recognized for over 25 years of excellence in neurosurgical stroke care. for expertise in delivering rapid surgical intervention and comprehensive acute stroke management, supported by advanced infrastructure including dedicated surgical systems. Congratulations, sir.
So I am indeed honored, and thanks for recognizing the neurosurgical aspect of the stroke. As the patient GCS falls, our GCS starts rising. If one pupil dilates, our both pupils starts dilating, and then it's the whole OT armamentarium which comes into the pictures, all from decompressions and evacuation of bleeds. I was trained to clip an aneurysm. So all the aneurysms were clipped, right, 15 years before. And now there's hardly any aneurysm to be clipped. But yes, we become a very small but important part as a neurosurgical team to support our neurology colleague. And I come from Max Healthcare, where Dr. Vivek Kumar is running a very effective stroke management program. Thank you.
Thank you, sir. Our next category is Stroke Care Leader of the Year National. And this award goes to Dr. Kunal Behrani. Professor Dr. Kunal Behrani, Chairman and Group Director of Neurology, is recognized for his leadership in advancing comprehensive stroke care and neurological services with world-class training and extensive clinical expertise. He has been instrumental in integrating advanced therapies and patient-centric approach, elevating standards of neurological care across the region.
First of all, thank you, VH. And it's a long day, Sunday, and I congratulate VH team. They're all team members for organizing such an event. And I think this award I dedicate to all my patients who have been treating for last 15 years, 17 years, to our team, Yatharth team, and my family at home. Truly appreciate. Thank you. Thank you.
Thank you, sir. Ladies and gentlemen, just one request. We are very keen to share this award with you, but with the interest of time, I would request to keep your speech short and sweet. Moving ahead with the next category, Stroke Care Leader of the National. This award goes to Dr. Praveen Gupta. He is the Chairman, Marengo Asia International Institute of Neuro and Spine. Recognized for his pioneering contribution to stroke care and neurological innovation in India. With over 2 decades of clinical excellence, he has led several firsts, including establishing the first stroke center in Gurugram and advancing interventional and surgical techniques, significantly transforming access.
Thank you, VOH, for this award and more so for bringing the cause of stroke to the forefront. Your commitment to stroke is really commendable, and we must raise a round of applause for VOH because they have done a commendable job. Thank you to the family whose sacrifices paves the road to success, the team on whose shoulders the whole system is built, and finally the unflinching trust of patients which makes everything meaningful and worthwhile. Thank you.
Thank you, sir. Our next category is Stroke Research Innovator of the Year. And this award goes to Dr. Pallab Bhattacharya. He is a professor at the National Institute of Pharmaceutical Education and Research, Ahmedabad. Recognized for his outstanding contribution to stroke research and innovation with over 100 scientific publications, multiple book chapters and a US patent to his credit. His work bridges the gap between clinical challenges and scientific solutions. Thank you, sir, and congratulations. Our next category is Hospital CEO Excellence in Stroke Care Implementation National. And this award goes to Mr. Amit Singh. He is the Group Chief Executive Officer at Yatharth Hospital, recognized for his exemplary leadership in strengthening stroke care implementation through strategic planning, operational excellence, and system-level development with over 2 decades of experience. Congratulations, sir.
Good evening, everyone. I'm deeply honored. I'm taking this award not as an individual, but on the behalf of all the clinicians sitting over here, nursing staff, technician, all the caregivers of the Yatharth family, who comes every day with this one mission is about saving life, and more importantly, it's about restoring the quality of life. So thank you very much. This I'm dedicating to them. Thank you. Thank you.
Thank you, sir. Our next category is Lifetime Achievement in Stroke Care and Neurology. For this award goes to Padma Shri Professor Dr. Kameshwar Prasad. Let's have a huge round of applause. He is the Principal Director of Neurology at Fortis Vasant Kunj, recognized for lifetime extraordinary contribution to stroke care and neurological science with over 4 decades of clinical, academic and research excellence. He has pioneered evidence-based healthcare in India. Dr. Kunal is here on behalf of him.
Thank you again, VH. So, Sir Dr. Prasad had been my mentor, and he asked me to collect this award on behalf of him. I'm sure he will be quite happy after this award. I'm sure. Thank you. Thank you. Thank you.
Thank you so much, sir. With this, we move on to organization category, because behind every successful stroke outcome, there is a system that works at a team that collaborates. So now presenting my first category of organization, Emerging Stroke and Neurosciences Center South. And this award goes to Neuro One Hospital. They are known for their strong focus on delivering quality-driven, patient-centered stroke care with advanced diagnostics infrastructure, critical care services, and a multidisciplinary clinical team and hospital which has implemented a fully digital stroke workflow system. Thank you, sir. Our next category is Emerging Organization in Stroke Care Excellence. And this award goes to Book My Rehab. They are known for their innovative technology-driven approach to stroke rehab, particularly in underserved regions. By integrating robotic-assisted therapy, hydrotherapy, and intensive rehab models with residential care, the organization is enabling structured high-frequency therapy that accelerates recovery and improves patient outcomes. Congratulations to the team. Our next category is Excellence in Advanced Neuro Rehab Services South. And this award goes to ESA Rehab. They are known for delivering comprehensive multidisciplinary neuro rehab services with strong focus on stroke recovery. Through personalized care plans, early intervention strategies, and team of specialists across physiotherapy, occupational therapy, speech and swallowing therapy, and clinical care, the center continues to improve functional recovery for long-term patient outcomes. Thank you, sir. Our next category is Excellence in Integrative and Holistic Stroke Rehab South. And this award goes to Ayur Green Ayurveda Hospital Private Limited. This hospital is recognized for pioneering an integrative stroke rehab model that combines traditional Ayurvedic therapies with modern neuro rehab science. With advanced technologies, multidisciplinary care pathways, and a strong focus on continuity of care, the institution is delivering holistic outcome-driven recovery for stroke patients. Congratulations to the team. Our next category is MedTech Innovation and Neuro Rehabilitation, and this award goes to Vivatronics. They are known for contribution to advanced neuro rehab through innovative medical technology, enabling improved therapy, precision, enhanced patient engagement, and better functional recovery outcomes in stroke care. Congratulations to the team Vivatronics. Thank you, sir. Moving ahead with Community Stroke Awareness Initiative of the Year. And this award goes to Genova Biopharmaceuticals. They are recognized for impactful nationwide stroke awareness initiative, driving early recognition and timely response through simple, actionable message such as "Be fast." Through a structured multi-channel approach combining community engagement, mass media outreach, and clinical preparedness. Let's keep our hands rolling for all the winners present here. Our next category is Excellence in Stroke Rehabilitation Services, and this award goes to Parul Ayurved Hospital. They are known for its pioneering integrative approach to stroke rehab, combining classical Ayurvedic therapies with modern rehab sciences. With multidisciplinary framework, advanced therapeutic protocol, and a strong focus on functional recovery. The institution has successfully improved outcomes for a large number of stroke patients while advancing holistic patient-centered care.
Thank you very much, VOH. So as I said previously also, that as an academic institution, we have all types of pathies available in our campus. We have 2 Ayurveda, 2 homeopathy hospitals, and an allopathic hospital attached to a medical college. And we have applied for Center of Excellence in Neurological Disorders to Ministry of Ayush. And we are developing a Center of Excellence for Neurosciences also. And sir, we are coming up with exoscope neuromonitoring system and intra-op MRI. So we have total team of 8 people in neurosciences with 2 neurologists and 6 neurosurgeons. And next year we are going to organize a national level conference for neurosurgery, wherein we will be inviting you all for that conference. Thank you very much.
Thank you, ma'am. Our next category is Dedicated Stroke Unit of Excellence South. And this award goes to First Neuro Brain and Spine Super Speciality Hospital. They are known for its exceptional commitment to dedicated stroke care, being a leading neurospecialist institution in South Karnataka. With advanced stroke intervention, high patient volume, internationally recognized accreditation, including WSO Angels Award and the establishment of hospital-based stroke registry. Thank you, sir. Congratulations.
Good evening, everyone. I am Dr. Vikas Prabhu, neurologist at First Neuro Hospital, and collecting it on behalf of the hospital. A journey of 1,000 miles begins with a single step, and I hope with taking such small steps, we complete our journey of ensuring life-saving thrombolysis reaches every nook and corner of the country. And as Sir mentioned, stroke care is a continuum. There is thrombolysis, thrombectomy, neuro rehab. Let's hope to fortify this continuum across all domains. And let's save those precious neurons.
Thank you, sir. Our next category is Comprehensive Stroke Care Center of Excellence South. And this award goes to Meenakshi Super Speciality Hospital, Madurai. They are known for its exceptional excellence in acute stroke and emergency medicine, with globally acknowledged achievement including diamond status and recognition from World Stroke Organization. Through rapid diagnosis, protocol-driven thrombosis, and strong clinical outcomes, the institution has consistently set benchmark in delivering high-quality, time-sensitive stroke care. Congratulations, sir.
Good evening, everyone. It's really wonderful and feeling great to receive this award. I would like to thank Voice of Healthcare and the jury for awarding our hospital. And this award I am receiving behalf of our stroke team, starting from the paramedics to the speech therapist. Thank you again for this award.
Thank Thank you, sir, and congratulations. We now move on to the next category, Premier Stroke Center of Excellence South. And this award goes to Apollo BGS Hospitals. They are known for their outstanding clinical outcomes, advanced stroke intervention, and technology-driven care, with innovations such as 5G-enabled smart ambulances, rapid stroke response pathways, and significant reduction in stroke mortality. The institution exemplifies excellence across the entire stroke care continuum. Our next category is Excellence in Acute Stroke Care Delivery North. And this award goes to Fortis Hospital Limited. They are recognized for its leadership in delivering advanced acute stroke care through rapid responses system 24/7, comprehensive stroke management and stroke clinical expertise in complex neurointerventional procedures. Congratulations, sir.
Good evening, everyone. My name is Keshav Salaria. I'm the Sales and Marketing Head at Fortis Escorts. And I really thank you. Thanks, VOH and everyone for recognizing us. And kudos to the campaign, BPA, BPCO, Helke Manale. It is fantastic. You know, we just, thanks to Dr. Puneet Banga, you know, we had the privilege of launching the first ever stroke helpline in Faridabad region, which is named as Sanjeevni. So it just reminded me of this. So kudos once again, viewers. Thank you. Thank you so much.
Thank you, sir. Our next category is Excellence in Acute Stroke Care Delivery National. And this award goes to Mazumdar Shaw Medical Center, Narayana Health City. They are known for their transformative contribution to stroke care at national level, combining pioneering clinical innovation in neurointervention with round-the-clock endovascular services. Through advanced techniques, streamlined stroke pathways, and a strong focus on research, rehab, and public health engagement, the institution continues to redefine comprehensive stroke care across India. Congratulations to the team. Our next category is Stroke Center of Excellence North. And this award goes to Yatharth Super Speciality Hospital for their strong and growing impact in stroke care delivery across the Delhi NCR region by integrating advanced technologies such as AI-enabled rapid imaging analysis with dedicated 24/7 neurointervention team and cath lab services. The institution has significantly improved treatment timelines and clinical decision making. Their approach spanning acute intervention to rehab continues to enhance patient outcomes. Congratulations to the team. Last but not the least, our next category is Stroke Center of Excellence National. And this award goes to Akinidu Stroke Center, Lalita PVS Institute of Medical Sciences. Do we have team of Akinidu Stroke Center, Lalita PVS Institute of Medical Sciences here? They're known for their comprehensive stroke care in India with a legacy of innovation, research, leadership and community impact as one of the first integrated stroke center in country. It has led advancements in acute intervention, stroke registries, clinical trial and public awareness while constantly maintaining global recognition including World Stroke Organization Diamond status. So can we please have you on stage? Congratulations to all the winners. And may I request all our award winners to please come on stage with their trophies for a group picture.
Thank you, VOH, for an excellent initiative and encouraging from startups to the established centers. And I dedicate this award to my stroke action team, as we call them. All of them are available 24/7. My colleague neurologists, neurosurgeons, interventionists, 2 paramedical, as well as the stroke care managers. And of course, all those thousands of patients who put so much faith in us, in me, and to manage their strokes over the 3 decades. Thank you so much. Thank you.
Thank you, ma'am. I request all the award winners, dignitaries, speakers to please come on stage. We want to have a group picture with you all and to capture this moment together. Also, I would just like to announce that as we come to close of this wonderful evening, I would like to thank everyone for making the Stroke Excellence Awards 2026 a grand success. Congratulations once again to all our winners. We look forward to welcoming you all next year for an even bigger and more impactful 4th edition of Stroke Excellence Awards and National Stroke Summit in June, Mumbai. And also to raise your trophies, please. This room. Thank you everyone and have a wonderful evening and see you at the next edition in June, Mumbai. Thank you.